Benefits of CBD oil. First off, cannabidiol is a phytocannabinoid found in cannabis plants. Cannabidiol can be taken into the body in multiple different ways, of which some are inhalation of cannabis smoke or powder, as an aerosol spray into the cheek, by mouth, ingested capsules and food products, vaporizing, tinctures, topical cream, and as a prescription liquid. Cannabidiol is still under research, so it cannot be stated if it is entirely safe for medical use. But still, cannabidiol or CBD oil has been proved beneficial in many cases, of which some are stated below. Having natural pain relief and anti-inflammatory properties. People tend to use prescription or over-the-counter drugs to relieve stiffness and pain, including chronic pain. CBD oil can be considered as a natural alternative to it. Quitting smoking and drug withdrawals. Some promising evidence suggests that CBD use may help people to quit smoking. A pilot study published in Addictive Behaviors found that smokers who used inhalers containing CBD smoked fewer cigarettes than usual and had no further cravings for nicotine. And CBD oil is also a promising treatment for people with opioid addiction disorders. The researchers noted that CBD reduced some symptoms associated with substance use disorders. These included anxiety, mood-related symptoms, pain, and insomnia. Epilepsy. After researching the safety and effectiveness of CBD oil for treating epilepsy, the FDA approved the use of CBD, Epidiolex, as a therapy for two rare conditions characterized by epileptic seizures in 2018. The conditions are Lennox-Gastaut syndrome, LGS, a condition that appears between the ages of 3 and 5 years and involves different kinds of seizures. Dravet syndrome, DS, a rare genetic condition that appears in the first year of life and involves frequent, fever-related seizures. Other neurological symptoms and disorders. It is noted that CBD has anti-seizure properties and a low risk of side effects for people with epilepsy. Findings suggested that CBD may also treat many complications linked to epilepsy, such as neurodegeneration, neuronal injury, and psychiatric diseases. Another study, published in Current Pharmaceutical Design, found that CBD may produce effects similar to those of certain antipsychotic drugs and that the compound may provide a safe and effective treatment for people with schizophrenia. However, further research is necessary. Fighting cancer. Some researchers have found that CBD may prove to combat cancer. Authors of a review published in the British Journal of Clinical Pharmacology found evidence that CBD significantly helped to prevent the spread of cancer. The researchers also noted that the compound tends to suppress the growth of cancer cells and promote their destruction. They pointed out that CBD has low levels of toxicity. They called for further research into its potential as an accompaniment to standard cancer treatments. Anxiety disorders. Doctors often advise people with chronic anxiety to avoid cannabis as THC can trigger or amplify feelings of anxiousness and paranoia. However, authors of a review from Neurotherapeutics found that CBD may help to reduce anxiety in people with certain related disorders. According to the review, CBD may reduce anxiety-related behaviors in people with conditions such as post-traumatic stress disorder, general anxiety disorder, panic disorder, social anxiety disorder, obsessive-compulsive disorder. No further definitive evidence currently links CBD to adverse effects, and the authors called for further studies of the compound as a treatment for anxiety. Type 1 diabetes. Type 1 diabetes results from inflammation that occurs when the immune system attacks cells in the pancreas. Research published in 2016 by Clinical Hemorrheology and Microcirculation found that CBD may ease this inflammation in the pancreas. This may be the first step in finding a CBD-based treatment for type 1 diabetes. A paper presented in the same year in Lisbon, Portugal, suggested that CBD may reduce inflammation and protect against or delay the development of type 1 diabetes. Acne. Acne treatment is another promising use for CBD. The condition is caused, in part, by inflammation and overwork sebaceous glands in the body. A 2014 study published by the Journal of Clinical Investigation found that CBD helps to lower the production of sebum that leads to acne, partly because of its anti-inflammatory effect on the body. Sebum is an oily substance, and overproduction can cause acne. CBD could become a future treatment for acne vulgaris, the most common form of acne. Alzheimer's disease. Initial research published in the Journal of Alzheimer's Disease found that CBD was able to prevent the development of social recognition deficit in participants. This means that CBD could help people in the early stages of Alzheimer's to keep the ability to recognize the faces of people that they know. This is the first evidence that CBD may slow the progression of Alzheimer's disease. As you might have noticed in the text above, most of the studies have called for further research on CBD oil, and also the lack of available long-term safety data compels us to think that CBD oil isn't totally safe for use. The soporific effects of CBD oil are linked to its concentration. Low concentration oils will produce minimal effects, while high concentration oils will produce strong effects. Furthermore, many small-scale studies have looked into the safety of CBD in adults. They concluded that adults tend to tolerate a wide range of doses well. Also, to date, researchers have not performed studies involving children. As for the side effects, researchers have found no significant side effects on the central nervous system, the vital signs, or mood, even among people who used high dosages. The most common side effect was tiredness. Also, some people reported diarrhea and changes in appetite or weight. The patient information leaflet notes that there is a risk of worsening depression or suicidal thoughts. It is important to monitor anyone who is using this drug for signs of mood change. Research suggests that a person taking the product is unlikely to form a dependency. In conclusion, there is often a lack of evidence regarding the safety of new or alternative treatment options. Usually, researchers have not performed the full array of tests. Therefore, anyone who is considering using CBD should talk to a qualified healthcare practitioner beforehand.